Doctors and nurses of Reddit, what have been your why didn't you come in sooner moments? Had a patient brought in by her son who took care of her. When she arrived to our unit, I performed a skin assessment. Took off her socks and found a fallen off gangrenous toe. Seems fake and I wish this was, but it was by far the nastiest thing I've witnessed. Son said he had no idea when his mother's foot became that bad. No words. I hate this because half the time the family is trying their best and simply overwhelmed with the level of care their family requires. Then sometimes they visit mama once a day and say you good? And act like they're infallible. I had a patient come in saying he couldn't see. How long had it been going on? For 5 days. The man had been blind for 5 days and didn't come in because he thought it might be like a cold or something. During the exam when I asked him to move his legs, he said, "Oh, I can't do that." ? I asked how long he'd been unable to move his legs or walk. Wife chimes in, about 2 years. Never saw a doctor about it, they just borrowed a friend's wheelchair and kept it rolling. Turned out he'd had multiple strokes with multiple risk factors he never addressed. Given how little insight he appeared to have into the condition, I honestly felt sorry he didn't have insurance, so I'm sure that played a role in him avoiding seeing anyone. AskReddit doctor here. A farmer in his 70s reluctantly came in with his wife after falling over outside while wrangling a sheep 1 week earlier. He did not want to be there but had been forced to come by his wife, who was worried about him. On examining, he was pale, short of breath, and clearly in pain all over the right side of his chest, but not wanting to show it. X-ray and blood showed he'd broken loads of ribs, punctured his lung and bled profusely into his chest, and was now very anemic. I'm a resident doctor working in a heavily agricultural part of my country. I've learned to become extremely concerned whenever I see a farmer, especially during harvest season, since being near death is usually the one thing that will convince them to come in. My dad, while not a farmer, goes to help the in-laws at their farm every lambing season. Last year he came home after being down there for 3 weeks and said 4 days in one of the ewes gave him a big stomp on the foot because he was trying to turn the lamb. He stayed the extra 2 weeks and a bit. Drove 5 hours home. Hobbled into work as a carer and then took the guy he was caring for to a doctor's checkup. Doc sees him limping, so checks out the guy, then asks dad what happened. He called dad's boss and told her to arrange cover and send someone to collect guy who was being cared for, and called the ambulance out. Gets to hospital and they send him for an x-ray. 8 of those tiny bones were broken and the bruising still looked bad. He ended up in a surgical boot for 3 months because 3 of the broken bones were in his toes. Story from my sil, who is a nurse. Young man was brought into the ER. He had a sinus infection that he had let go to the point that it had eaten through the skull and into this brain. She was told that it had started several months before. He didn't want to go to the doctor for it. All it would have needed was 10 days of antibiotic pills. Instead, he was not brought in until he was unconscious and died within a few hours. Children's nurse here. My first week in pediatric ED, we had a young girl, 6/7, come in with a really swollen jaw face. Poor girl was unable to move her jaw without intense pain and hadn't been able to eat for several days. Turns out she had only just started cleaning her teeth for the first time ever and managed to develop several abscesses and rotten teeth in the process. To make it worse, her mum told us she was recovering from the same procedures to remove most of her teeth because of almost the same thing. They didn't want to bother the GP as they thought she was just messing about to get out of school. Not a nurse doctor but a lab scientist. Had a guy come in at the end of the day for chest pain that's been bothering him all weekend. The ED doc ordered a troponin blood test which helps rule out heart attacks. If the test runs above 0.03, we consider that a sign for a heart attack and act accordingly. This guy's very first troponin was 21.00. The highest we've ever had up till then was an 8.00. The guy should have been dead ages ago, but he somehow pulled through. Don't ignore chest pains, people. Edit. Just wanna clarify that the hospital I work for is a tiny ass 25 bed rural community critical care hospital. Definitely not a place with dedicated cardiologists, cath lab, bedside assays, or even a big test menu. Period. Bare basics. And the guy did somehow end up surviving. My girlfriend is a care worker and she recently told me that she slipped off a patient's slippers and remarked, "I didn't know you had lost your toes," to which the patient responded, "Well, I had until you took the slipper off, dear." Sounds like something from a grim sketch show. God bless anyone who can do jobs like that. I used to work on a burn unit. We cared for burns but also other major skin issues, including frostbite. There were plenty of times when patients' fingers or toes would come off while I was changing the dressings. You never quite get used to that. My dad is the one that wouldn't go in. He got a sore in the crease on the bottom of his second toe, the one next to the big toe. So it would be the piggy that stayed home and just kept ignoring it. He would go with his wife to her nail place and have his toenails trimmed, and I think that's where the infection probably got in when they soaked his feet. He blew it off for a couple of weeks until the wife made him see the doc. It's a good thing she did. The infection had gotten into the bone, so they had to snip his toe off to the first knuckle to catch it before it went any further. The doc said had he waited any longer, he could have lost the entire foot. He's lucky to just have a stubby piggy and not a stubby leg. Not a doctor or nurse, but worked as a doctor's office assistant. A regular patient, who was very sweet but unfortunately had an ongoing battle with alcoholism, was brought in by his roommate, and I knew instantly that he would be dead soon. I'd seen some jaundiced humans in my time there, but this man was a yellow I never knew was possible. His roommate said, through tears, "I've been telling him to come in for weeks." And the patient kept telling roommate to relax, that he was fine. Majorly in denial. I helped him to the exam room, and when the doctor entered the room, he immediately asked me to go call an ambulance. A few weeks earlier wouldn't have helped, but perhaps the end could have been made a bit easier for him. He died 7 days later in the hospital. Hit me very hard because I'd known the guy for a few years. Sometimes he would be sober when he called, and sometimes he would be slurring and completely incoherent. But he was always kind. Maggots. Whenever it's gotten to the point of maggots, it's like 100 alarm bells that this person's living situation is no bueno. Maggots in the abdominal genital skin folds of a morbidly obese woman who refused to let her daughter take her to the doctor until the smell was so bad the neighbors complained. Saddest, grossest patient issue I ever saw. And she was inpatient for weeks, with Q4 dressing changes that needed at least 4 people to assist. Awful for her. Awful for us. I've seen a few over the years, and they generally fall into the category of if it's not diagnosed then I can't have it, or I didn't think it was that bad. As a medical student, I remember an older lady that had a breast that was necrotic and falling off. It had been progressing over the last several years, but if she didn't get diagnosed with breast cancer, then she couldn't have it. In the other category, I've seen a few cases of Fernie's gangrene. Pretty much obese male diabetics that had a pimple sore that started in the pubic region. By the time they come to the hospital, it's a raging infection where the treatment is basically to cut away everything in the pubic groin region down to the muscle layer. That little sore didn't seem like much at first. I was working as a surgical junior when my team was called down to A&E to see a patient who had come in with a complication from a recent hernia operation. When we came down, we saw that the patient was holding a plastic bag over their abdomen. When this was removed, we found that their wound had opened and their intestine was visible to the air. It transpired that this was not something that had happened overnight. It had taken several days. The patient had started using plastic bags and newspaper to dress the wound when they ran out of dressings. We once had a patient who went to emergency for abdominal pain and they discovered a fungating breast wound. Don't image search that she'd had for 2 years and hadn't gotten medical attention for. A biopsy and a PET scan later, she was diagnosed with breast cancer with extensive liver, lung and bone mets. This was also in Australia, so it wasn't a money issue. Just sad. If you hadn't put on Google search that, I probably wouldn't have and went on my merry way reading FK'd up stories. But no, I just had to Google it. Disgusting. Holy jeez. Oh. So many stories here. We can start with a gentleman in his 70s who was diagnosed with diabetes. His doctor had instructed him that it's important for him to wear socks and supportive shoes throughout the day. So this guy decides that meant wear the same pair of socks for weeks and never take them off. He had showered, slept, and carried on in the same pair of socks for weeks. He came to the ER because there was blood oozing through his sock and there was pain under there. Take the sock off. He's got a diabetic ulcer that had opened and was full of maggots. Not a pretty sight. We clarified those instructions pretty quickly. Not a doctor, hospital staff. But my grandpa ended up passing away because he waited too long before going to the hospital. This was about 17 years ago. He was tending to one of his mules when something spooked it and he got kicked in the gut. He was in a lot of pain. Could barely move due to the abdominal pain, so decided to take it easy and lounge on the couch for a week. He refused to go to be taken to the hospital. Unfortunately, that mule kick ruptured an unknown tumor in his intestines. The doc said it was huge. Like volleyball size huge. And he may have survived if he came in sooner. By the time we got him to the hospital, he had a severe case of gangrene. His leg needed to be amputated within a day of him being there. He passed away a week later. Not a doctor, but an army medic. Had a dude come into the aid station at like 2 AM with his arm all wrapped up. Took the wraps off. He looked necrotic. I asked him what the FCK was going on. Turns out, the weekend before we went out to the field, this man went and got his whole forearm tattooed. He then spent the next week wading through chest-deep swamps, figuring that if he just kept his arm wrapped, he'd be okay. I was like, brother, no. Edit. Oh yeah. There was also that time some female LT came in with vaginal pain. Took a look. Saw one helluva infection. Apparently, she hadn't changed her tampon in nearly a week. We, meaning I, while the DR watched, had to retrieve it. Once had an older lady call in wanting a prescription for pain meds because she was sure she had shingles. Said her neighbor had them and she was sure that's what it was. She hadn't been in for an exam in almost 2 years. So the doctor asked that she come in to be evaluated before a prescription could be given. She refused and called again the next day asking for a prescription. This went on all week. Her calling for pain meds. The doctor asking her to come in to be seen. She finally agreed to make an appointment. It wasn't shingles. It was a skin ulceration from advanced breast cancer. Open bracket. I work in orthopedics. A very common occurrence is a patient is told to follow up within the week. We like to see fractures between 5 and 7 days, and the patient will call on the 6th day and say I broke something and need to be seen tomorrow. This is frustrating because we very rarely have the ability to get a patient in next day. And if they had called the day of or the day after, then we definitely could have gotten them seen. But my number one why didn't you come in sooner moment was getting a call from a patient who had broken their forearm 2 months ago and never followed up. I got them scheduled. They no-showed their appointment. Rescheduled. They no-showed. Second reschedule. They arrive with a very obvious deformity to their arm due to the fracture healing incorrectly. If they had just come in, it wouldn't have been an issue at all. Blows my mind that they went almost 3 months without care. Not a doctor or nurse but the patient. I went into my doctor with some back pain and also brought up that my leg was swollen. The doctor I saw said it was probably just swelling due to sodium intake. A week later, the pressure and pain in my leg was so bad that it hurt to walk. I called off of work and had my husband take me back into the doctor. The doctor took one look and told me to get to the hospital immediately. He suspected I had a blood clot. I ended up having a massive blood clot from my hip to my knee and pulmonary emboli. I was transferred to another hospital for surgery and stayed in the ICU. Had I waited any longer, I would have died. Nad. But the patient a few years ago. I had a boil on my butt that I thought was MR. Tough guy, I could walk it off. No you can't. I was in so much pain. Couldn't sit or stand near the end. I could only limp along or lay down in an extremely convoluted position. I went over 2 weeks before it got so bad I couldn't stand it anymore. I finally went to the ER to get it drained, and the doctors they were not really happy with me when I told them that I'll let this try go away with Epsom salt baths or my own wishful thinking. For my stubbornness I earned myself a staph infection and a very upset doctor who let me know in no uncertain terms I brought this upon myself. This happens all the time because healthcare is a financial decision in America. That reminds me, just a student. There was a patient who was self-employed and didn't have health insurance. Post Affordable Care Act. Because of the expense. She didn't have a regular doctor for regular checkups and also had been ignoring her heart palpitations. Eventually, she fainted. It turned out she had a heart condition and would need medications with regular adjustments for life. While she was in the hospital, they also found out she had hepatitis C. There's a cure now, but she couldn't afford it. So she will likely get cirrhosis and need a transplant that she also won't be able to afford. I remember that she was just so overwhelmed from finding out all these health problems at once. She had also come to the hospital from the ER and wasn't sure how to even pay for that. She was in her late 30s. Single mother. And she had just had the rug pulled from under her. This happens all the time. People have a big stroke at home and can't move an entire side of the body. They wait several days thinking it's a flu or something. Nope. Not the flu. Just a large clot in the brain that could have been reversed if you came in right away. I was this patient lol. When I was 18 I went to the ER for chest pain. It was the most painful thing I had ever felt. Seriously. I felt like the guy from Alien. A few hours later the ER doctor released me, telling me I had acid reflux and would be fine. Over the next 2 years this was a continuing problem. Once a month, and seriously. It was that predictable. First Saturday night of every month. I would get this terrible chest pain. No amount of antacid medicine would help. From over-the-counter medications to prescription. I tried not eating that day. Drinking milk. Sitting straight up all night. Nothing helped. Finally, after I literally passed out from the pain one time in front of my mom, she convinced me to see a doctor again. The doctor, the first female doctor I had seen, by the way, sent me in for a gallbladder ultrasound on a hunch and they discovered well over 100 stones in it. Cue emergency surgery. Dumbfounded surgeon. And a doctor amazed I had been passing gallstones for 2 years on the regular. Not me, but my brother is an EMT for a warehouse. He recently had a guy come to his station saying something was wrong with his toe. So he asks him to take off his shoe. Which he does. My brother was about to ask him to take off the bandage around his big toe before he realizes that that wasn't a bandage. It was his skin. Apparently, this guy dropped a 20-pound tote on his toe a week earlier and had been showing up at work anyway. They sent him to the doctor. The doctor sent him to the ER. Diagnosis came back as a tissue infection as well as osteomyelitis, a bone infection. But wait. There's more. The guy come back from the ER and tells him that he doesn't want to go through the ER doctor and would rather go through his own insurance. My brother explained to him as best as he could that, as it stood, he was already likely going to lose his toe, and if he waited any longer to get it treated, he ran the risk of losing his entire leg. Not sure what happened after that. I just hope he got the point. I'm that person though. I'm embarrassed to admit it. But my daughter's teeth were rotting due to a heart condition. We had to save for months for the surgery to extract the teeth. We are in US and it was seen as an optional surgery. Not covered by insurance, so it was close to $7,000 when they brought the extracted teeth to us. They were so rotten you could see the root. I cried thinking about how painful it was for her to eat. We had always brushed, but a mix of antibiotics and pain medications from an early age, 6 months, made her teeth basically mush mush. It was horribly embarrassing, and explaining to the doctor and dentist that we knew, but didn't have the money. They just looked at us like we were horrible parents. Elderly woman fell at home and broke both femurs. Son thought she just needed to rest, so he carried her to her bed. She laid there in her own filth for 3 days before anyone called 911. The son lives with her. And there's family next door as well. How? Why? This is one of the worst responses to this question that I've read. That poor woman. I hope she didn't have to go back to that house after being treated medically. Nurse here. There's plenty. But the latest one that comes to mind is this woman who came in for abdominal pain. Thing in. 5 days before admission. She had fell and hurt her head. It got ignored through ED, because while looked closely at an open head wound, and straight up to our floor. Where we decided to clean her up. After cleaning up some of the blood. It seemed like the wound was moving. Surely F-king enough, maggots. Ended up cleaning them out. But I raised both the question of why would you wait and wait? You didn't even come in because of this? Double quote. Nurse here. Had a diabetic who couldn't afford to fill his oil tank during the winter. He was young too. Early 40s. Anywho. Had neuropathy in his feet so couldn't feel that they were becoming frostbitten. He had also been wearing his winter boots 24/7 for warmth. His sister went to check on him one day after she realized his phone was shut off by. She brought him in because she thought he seemed off. The doc asked me to take his boots off. One of his toes came off with the boot, no joke. He ended up having a below the knee amputation to one leg and a transmetatarsal amputation to the other and on IV antibiotics for weeks. Diabetics. This is why us nurses always preach check your feet. When I was training to be a nurse, I got paired with a play specialist for a few weeks. A mum came into R&D with a little boy of about 4 or 5. Doc requested we come and entertain distract little man while he examined him and left it at that. He was happy, chatty and a picture of health from the shoulders up. His belly however looked like he was expecting very soon. This was a shock to both me and the other girl who had taken the usual toys. We had little baskets for each of us to take where needed. We trailed this little guy while he had a multitude of tests and he was extremely brave letting the docs do what they had to. Mum was asked how long it had been going on and she said 3 months. He had a tumor and the surgeons managed to remove it, but the poor kid was so embarrassed after surgery because he had saggy skin and stretch marks. He often plays on my mind. Even more so since having a kid of my own. Hope he's doing okay now. Last term medical student here. For part of your surgical rotation we had patients selected from the ER to be student friendly in regards to the symptoms they were seeing healthcare for. An elderly man had a lump in his groin and was then selected to see me. Went in and talked to the patient as well as examined him. The lump had troubled him putting on his pants for a couple of months. He hadn't shown his wife or no one else. I could instantly see that it wasn't a hernia as suspected, but a giant tumor with several lymphatic metastases. Found around 5. T-cell lymphoma it turned out. Don't know if he lived or not. As students we don't follow our patients for very long. The thing I'll never forget is the fact that he'd come straight from work. Had a badge with his picture on it. And it looked like another person. It was like he was a husk of himself. His face was so skinny. PS. Swedish mid-student. Edit. Added space since it turned into wall of text. Not a doctor but medical physicist. About 12 years ago I was asked to look at and give advice on a lady who had a very slow growing tumor on their nose. A basal cell carcinoma. Usually not much of an issue as if caught early can be cut off with surgery and that's it or a short course of radiotherapy. Turns out this lady was quite vain. And as soon as the lump had started to grow she hid it under a scalp. She ended up hiding it for 20 years. By the time it was seen by any medical professional the tumor had taken over most of her nasal cavity. Had crushed one eye. Deformed her whole face. And grown in between all the nerves and blood vessels. It was inoperable and there was very little you could do with radiotherapy without doing a lot of damage to everything else. Such a shame as it would have been so easy to fix 20 years ago. Please get lumps and random bleeding checked out. I had a patient in the ER who struggled with alcoholism. She'd been having dark stools for some time and then had been vomiting up blood and clots for a few days. She ended up coding and had either esophageal varices or a massive dissecting aortic aneurysm. I don't remember which. If she'd come in earlier in the week they probably could have saved her in surgery. It was sad. Especially to see her family say goodbye. Also the patient with diabetes who had wounded, caked leg sores for years. That smell may never leave me. Super nice lady. I felt awful for her. EMT here. Had a lady call in at 5 AM for a GI bleed. It took several minutes to get into her yard because of her 12+ large dogs, but when she collapsed through the screen door of her porch, we just went in kicking. We got her to our truck. And just as we started hooking her up, she seized and went into cardiac arrest. We got her back. We kept her back. But she eventually passed. If she had called just an hour earlier, maybe we could have saved her. Or at least given her a better chance. Guy came in with a dead leg. Waited until it turned black and then decided to head to the ER. They tried an angiogram to open up blood flow, but it was way late for that. Guy had several clots in his lungs and legs. Undiagnosed atrial fibrillation. He couldn't believe we were going to amputate. Kept asking me what else I could do. Go back in time a week ago and come in. Kinda around when it turned blue. I am an EMT and have some pretty gnarly stories. One of the worst things I've seen, mostly is because of the smell, is gangrene due to lack of control over diabetes. The call came in as extreme lower limb pain. We pull up on scene. I examine the wound to see a man's metatarsal exposed, yes. The bone. And maggots were eating the wound. Long history of diabetes. And of course, did not do anything to control it. He eventually had his foot amputated. The smell is something that has stuck with me and probably will forever. Just take care of yourself. Get help when you need it. I once worked in a dermatology and rheumatology ward, and while the patient themselves didn't wait too long. They came from a nursing home. They were admitted the night before I came on and they had a bed sore on their sacrum, just above their ass, that was so large you could fit your fist inside it and not touch the sides. I'm talking up to your wrist. They also had bed sores on the hips, heels and shoulders. We had to order in a special sci-fi herb for them to try to help them. The only time in my life I've seen that machine be necessary. It is as cool as you think. By the way, they were in so much pain that they were kept sedated at all times. 2. It was a nightmare trying to fix them. But eventually we managed to get them down to minimal wounds and they were discharged back to the nursing home. Within a month she was back and they were worse than before. She died in hospital. If they'd actually cared for them properly or admitted her to hospital earlier, she'd have lived. Not a doctor. Just a customer from a grocery store. I used to go there every day at the same time to buy bread. And the owner of the place usually worked around that time of the day. One day he got a nasty cut on his hand. He was old. So he just dipped his finger in chlorine. From a recipient they used to clean the cutting tables. Anyway. Some days later he got a dirty cloth over the wound. It was really painful for him. Anyway. 2 weeks or so later he wasn't working. And one of the guys there told me he was on the hospital. Next time I saw him, he lost his hand to severe necrotic damage. Years ago as a nursing assistant on an oncology floor we had a guy admitted because he had had an erection for several days and had lost the ability to pee. His bladder was close to bursting and his poor junk was, think microwave hot dog, really bad. But none of that was as interesting as the fact that this guy had untreated skin cancer on his nose for several years that had over time become infected, developed MRSA, and spread across his face. He had no nose, no cheek, and no eye on one side of his face, and was starting to lose his other eye. You could see part of his f-king skull. I don't know why he chose to leave it untreated and I have no idea how long it took to get that bad. But I will never ever forget the smell and texture of his rotting face. On the upside, we were eventually able to convince him to have reconstructive surgery. He ended up getting a skin graft that covered up his eye, nose and cheek. So, if you ever meet a very grumpy dude with nothing but a mouth and one eye, Know that this is way better than the alternative. Guy had been having ball pain for 2 days. Didn't want to come in due to COVID-19 fear and lockdown. We found out he had a testicular torsion. Unfortunately that's 2 days is far too late for salvage. I don't know how he could have tolerated it. Usually people come in a sap. Cause it's that painful. Maybe for some it wasn't as painful him, or he has better pain tolerance. It's not nice to say why didn't you come in sooner to a patient though. Cause circumstances are tough as it is. My favorite story, Psych NP. I was called to a suburban ER to see a man who said he had a horrible stomach cancer and needed to lose weight in order to get better. He insisted that he'd been diagnosed by a very prominent gastroenterologist with Barrett's stomach, which isn't even a thing. It's an esophageal problem. I guess I got called in because the story was bizarre and the staff didn't know what to do with him. He eventually disclosed that he'd shot himself in the leg a few days previously and was waiting for gangrene to set in. He believed that the resulting amputation of the leg would allow him to lose the required amount of weight, thus curing his cancer. I excused myself to let the ER staff know that they should probably examine the leg and to call the county psychiatric service, which was protocol at this particular hospital. I'm not sure whatever happened to him, but that was a very impressive manifestation of a delusion. My dad works as a nurse in the ER. My man had been doing mechanic work all night in the middle of winter. He came in complaining that he couldn't feel his fingers because they had gotten so cold. They weren't just pale or purple. They were literally black. His fingers had gotten so cold that they literally died and had to be amputated. I am a doctor, and while working in A&E we had an older chap, possibly in his 70s, who several days prior to presentation had a sudden onset severe chest pain and vomiting while loading the car with shopping. He ignored it and struggled home. The next day he started to lose the use of both legs, and by the time he came to hospital had been crawling around his house for several days because he thought it would get better. He had had a major cardiac event. Developed a clot which his heart had pumped out. It went down his body, broke in half and blocked off the blood supply to both legs. He literally had dead legs. I don't know what ended up happening to him, but there was no way to save the legs, and I reckon the outcome was very poor, if not fatal. My grandparents lived in a remote corner of WA state, an hour away from the nearest Pidilai small town hospital. Grandpa had been recovering from bladder cancer and became dependent on pain medicine. Grandma and my aunt were doing their best to care for him at home. They told the doctor about the issues with his pain meds and they tapered him off. After a few weeks, he began asking for more pills again. The complaining got worse and worse. Grandma assumed that he was just trying to get more drugs. It took a month or two of telling him no before they gave in and brought him back to the hospital. Turns out the cancer had returned aggressively. He did develop a dependence on the pills, but he had also been in agonizing pain the whole time he'd been at home. By this point there was nothing that could be done, and he passed away very quickly. There was a tremendous amount of grief in the family. Nobody blamed Grandma and my aunt. They did the best they could in the circumstances, but they felt a lot of guilt, and there was probably some underlying resentment to them. The family has really not recovered, or even gotten all together since, except for Grandma's funeral. Not an MD or nurse, but when I was receiving a treatment for my myopia at a clinic, there was this little girl who fell down on some wires which pierced through her face and one of her eyes, and it was all bleeding. So her parents thought it'd be fine to just wash her eye and press some cotton pads would do the trick, and waited a whole freaking day to bring her to a hospital. So as a result, poor girl lost one of her eyes. Doctors got so mad that they started to yell at the parents, asking what the hell is wrong with them. Some nurses and patients were crying for her. She was a cute little girl. I was shocked by the level of neglect. I mean, poor girl had a freaking bleeding eye and they were like, I have to work today so we'll see a doc tomorrow. And that was their actual explanation. Freaking work. Why people even make kids if they're not going to prioritize them? My dad is a doctor and he once told me a story where a woman came in to see him. Her problem was that she had a potato lodged inside her vagina. The "why didn't you come in sooner?" is that the potato had sprouted roots and growths around it. meaning it had to have been in there for a while. This one seems to come in with every one of these threads. It's always my friend, dad, uncle, etc. was the doctor and the woman has the potato in her vagina. It's like the granddaddy of all urban legends. Why would any woman even put a potato up there in the first place? I think the original that I read, back in the 90s, was to keep her uterus from falling out. So this one has been around for a very long time and won't seem to die. Patient here. When I was 15 or so, I was horsing around with my little sister and her friends. I ended up accidentally kicking the very solid coffee table. The pain was unbelievable. I hobble into the kitchen and sit on the floor, holding my foot with tears pouring down my face. My mom tells me to walk it off and implies I'm being a bit dramatic. 3 weeks later, she finally takes me for an x-ray and lo and behold, I've fractured several bones in my foot. The doctor asked why we didn't come in sooner, as they could have given me a boot crutches and saved me 3 weeks of walking around on a fractured foot. Luckily everything healed okay. But the doctor did scold us for not coming in sooner and scared the living shit out of my mom with all sorts of horror stories about what could have happened. Years later, I still bring that up to my mom if she implies I'm being dramatic. Patient here. When 11 years old, mom took me to emergency room because my thumb was infected with big pus bubble below the nail. I remember doctor and nurses telling mom that it was a waste of time to bring me in, that I should just soak my thumb in warm water and Physohex, over-the-counter antibacterial soap. 4 hours later family was shaking me to wake me up and I had red streaks up my arm from blood poisoning. It took 3 months before I could straighten my arm. My tooth has been hurting for a couple of months. My face started swelling a few days ago. It became hard to swallow last night and now I'm having trouble breathing. Double quote. Guy had Ludwig's angina. He couldn't be intubated because of the swelling and had to get an emergency trach when he stopped breathing and his O2 stats plummeted. IV antibiotics for 2 weeks. Admitted to the hospital for 4 weeks. Easily could have died. All because of a dental infection. See your dentist. Boys and girls. I'm a dentist and saw this when I was on call during my hospital residency. I prescribe contacts. Desert Storm infantrymen home for furlough. You left them in how long? Double quote. 9 months, sir. They didn't have any water over there. Double quote. Had a guy come in with his pregnant wife in a wheelchair. The baby's head was hanging out of her and we asked why she didn't go to the maternity ward when she was 4. 1. He said that the waiting room was busy and he wasn't waiting because she had some pains and they were only there to shut her up. She ended up delivering around 20 minutes after she got taken back and I dread what could have happened if he refused to wait the A&E times 2. Had an older female patient come in for abnormal labs secondary to extreme diarrhea. Her potassium was critically low and all of her other labs were out of whack. Turns out she had been having at least 5 totally liquid stools for 6 weeks before she sought out any treatment. 3 days of that nonsense and I would have been in urgent care. Her poor butt. Totally red and excoriated. Every time I had to clean her up I could only think of the scene in P&R where Chris says stop pooping in the mirror. Or RN. Was on call on a Friday night. Got called in for an exploratory laparotomy. Some late staff had gotten the case ready and patient in the room when I arrived. I walked into the room to see the patient's testicle was bigger than a basketball. 2 people holding it up to prep it. The guy had a large part of his bowel in his LFT testicle. And his bowel had ruptured due to the pressure. We suctioned poop out of his abdomen for over an hour. Apparently the week before he lifted something heavy and felt a pop. Hadn't urinated in 2 days because it was so swollen his penis was not visible. That's why he finally came in. He couldn't pee. Although his testicle had been slowly growing for a week. Unfortunately he didn't make it. He lived through 3 abdominal surgeries but sepsis did him in from the ruptured bowel. Sitting here as the patient. Had a couple of seizures at 2 AM thanks to what turned out to be a silent UTI. My parents' answer to this, because I was a little out of it, was she complained of pain last night but it didn't match the symptoms. Isn't she too young for a UTI? Double quote. Nope. I went through 2 full bags of saline before I got released. I got through a full 32 ounces cup of water as well. In the 20 minutes from the hospital to home. I was pretty out of it for the next few days. But recovered by the next week. Just in time for COVID lockdown. I have the worst luck sometimes. Nad. German paramedic. Got a call. Maggots falling out of the shoe. He was a guy with a government supervisor because of mental health. Who had worn the same sock for about 4 weeks. Because a little wound dried blood into it. It hurt to try taking it off. After 2 weeks it seeped into his shoe. So he kept that on too. For the 2 weeks until we got called. Luckily I had a cold. Meaning blocked nose. We didn't do anything. Just a trash bag around foot and leg. And off to the hospital. The head nurse took one look at the trash bagged foot and directed us to the operating room. If the governor guy had directed him to his normal doc early on, he'd still have both feet. At least my colleague got to tell the gov guy that this was his responsibility. In which he failed. And that's spectacular. Former medic here. Called to a patient who had cut their leg while chopping wood about a week prior and now it was really itchy. Old gentleman. Didn't drive. Lived alone. Got to his house. Unwrapped the ungodly swollen leg to find that he'd tried to superglue the wound closed and maggots had commenced to growing inside. The itching he was feeling was the writhing maggots under his skin. Not a doctor. But. Close bracket. My dad felt lousy for 2 weeks or so one December. He didn't know what was wrong. He just figured he'd gotten a bug somewhere. And after a couple of weeks, he started feeling better again. Yay. Less than a week later he started feeling terrible again. And this time it was bad enough his girlfriend took him to an urgent care. The people at the urgent care told them to get to the emergency room ASAP. Like. Get there yesterday. So she took him to the ER. They started checking him in. And he died. It turned out he'd been leaking stomach acid into his abdomen. Close bracket. Not a doctor or nurse. Patient here. Was having problems with my arm going numb. General fatigue. Like I could literally sleep 20 hours out of 24. Lay back down and sleep some more. Then back pain. Finally went in to see my doc. And my BP was 190/101. Yo, I got a dressing down from my doc for that one. Was still working all that time. Was told I was lucky. Because if it had gone up more, I could have stroked out. Would have been a disaster if I'd been driving. I'm a mail carrier. Imaging guy here. I have a million of these. I work with vascular patients and wounds. Had a guy whose foot was completely broken sideways at the ankle. He had it still wrapped from when he left the hospital. He would use the stumpy parts to move around on his wheelchair and leave little blood sponge prints on the floor. Another guy with bad ankle and foot wounds decided to stop going to wound care. And was afraid to take the wraps off even after his foot started to stink. By the time I saw him his skin had kinda liquefied. Earlier on in my career I saw the guy with necrotizing wounds to both legs that had eaten to muscle in multiple places below the knee. I asked him how long they looked like that and he said about 2 years. Next time I saw him he was bilateral above knee amp. Stump wounds. Just stump wounds. Take care of your feet, people. If you're diabetic and can't feel the bumps and scrapes, please check your feet regularly. Had a patient, older guy, poorer, farmer, who'd been in the hospital about 2 weeks before he showed up in the ER. Came in late at night. Doubled over holding an old coffee can. Turns out he had been discharged from the hospital with a urinary catheter in place and was supposed to follow up with his MD's office to have the catheter taken out. Obviously didn't go to his appointment. Turns out after a few days at home the catheter bag he had tore on something. So, being a do-it-yourself kinda guy, he just started letting the catheter drain into an old coffee can. Needless to say, he had probably the worst urinary tract infection I'd ever seen. His urine was essentially just pus. My gran was the patient. I can't remember now what had happened that prompted the hospital visit, but the doctors diagnosed her with cancer and reckoned she'd had it for about 2 years. She knew something was wrong but didn't want to stress or worry us any, so kept it to herself. Doctors gave her about 2 months, telling us she wouldn't see her 80th birthday, but that wee woman stuck around for her birthday, 2 of my cousin's birthdays, and my birthday, before passing away a whole 3 months more than the doctors originally gave her. Had a PTVBAC at home and then came to the hospital with the baby. When we asked what the hell was she thinking, she stated she took some meth, had to poop, popped out baby, then called EMS. She didn't keep that baby, and also had to get transferred to CCU cause of a massive infection she got having a baby in a methed out bathroom. Not a doctor, but this is pertinent. I set up group health for a company and I was helping the employees pick out his health plan. He informed me that he hasn't been able to go to the doctor since he got off Medicaid at 18. For 10 years he's been walking around with a split skull, and you can stick a penny in the crack and it'll stay there. He knew a big cyst had formed in his forehead, and he told me he had been randomly going blind and blacking out for 3 years and it was getting worse lately. The guy worked on top of buildings doing construction and drive a work van for the company, and they had no idea. Some days he wouldn't come in and they thought he was just passed out drunk or something. No, he was out with migraine blindness. I told the guy to go immediately the next day and not wait for his F-King card to come in the mail. Neither doctor nor nurse, but I worked in an ER for several years. A patient dropped a piece of wood on his toe and the nail lifted up a bit. He didn't see a doctor and instead let his wife bandage it. He came to us a few weeks later because he showed signs of infection. I sat next to the doctor when he took off the bandage, and guess what was under his nail? Maggots. A lot of maggots. "So why didn't you come in sooner?" was one of the many questions that were asked. ERPA here. The worst I ever saw was a man in his 50s who was an alcoholic and had anxiety problems, who was brought in by his neighbors for a facial infection. Turned he had squamous cell skin cancer that made the left side of his face look like the Batman villain Two-Face. The CT of his face and neck revealed that it had spread into his lymph nodes and mandible. The skin on his face was literally sloughing off as I spoke with him, and the smell was absolutely horrible, and I smell terrible things all the time. I have never almost vomited in a room except for him just due to the smell. I asked him why he waited and he said he was just terrified of doctors and hospitals, and I believe him. He was extremely anxious the entire time he was in our ED. His neighbors were saints. They said they had been trying to get him to the hospital for months but he wouldn't come in. We transferred him to a tertiary hospital with ENT and cancer specialists. When I checked his chart a few days later, they basically said he was terminal. Dental hygienist here. I see a lot of bad cases due to many Americans not having health insurance. I was taking x-rays on a patient once when suddenly one of her lower front teeth fell into her lap. She hastily picked it up and put it back into her jaw. It was only being held in by hardened up plaque and had been for over a year. She had to have all of her teeth extracted due to advanced periodontal disease. Had a tall lanky patient come into urgent care with chest pain and shortness of breath after smoking weed. Literally textbook for a pneumothorax, collapsed lung. I asked him how long this has been going on and he said 2 days. I thought there was no way the guy walked around for 2 days with a collapsed lung. But sure enough, after the x-ray we diagnosed him with a severe pneumothorax. Straight to the emergency room for a chest tube. I read medical records for a living. Older man develops a sore in the cleft of his butt cheeks. Ignores it. He ignores it until he can't sit anymore and must lie in bed on his stomach all day. He gets weaker, to the point that he can't get out of bed alone. He and his wife just keep thinking it will pass. Eventually, she's half carrying him to the shower and bathing him while he stands. The wound is massive now and black. Chunks of it fall off in the shower. He doesn't care anymore. He just wants to go back to bed. His wife complies. Finally, when he becomes minimally responsive, she brings him in. 3 weeks later, he dies, never having left the hospital again. I remember reading that. wondering if she had a low IQ or if she wanted to kill him. How can you watch chunks of a person fall on the shower floor and still think things will get better on their own? Piku nurse here. Known diabetic 15-year-old told her parents she wouldn't go into the hospital for high blood sugars. All they would say is over 300. Since she knew she would be in the hospital for a few days and wanted to be out of the hospital for her sweet 16. A very long story short. She went unresponsive on the way to the hospital after passing out. She went into Dick, and when she was allowed to pass she had 10 L of blood products that were not hers. We tried everything we possibly could for 8 hours. Patient here. I tore a tendon in my arm in late August and went to an urgent care when I could no longer rotate my forearm. They took an x-ray, said nothing was broken, and sent me home in a splint. My GP said to see an orthopedist, which I finally saw 2 weeks after I first injured myself. She took more x-rays that came back normal and I asked for an MRI. My MRI, done 7 weeks after the injury, showed I tore a tendon in my wrist. A week later my orthopedist confirmed it and has set me up to consult with a surgeon. My appointment just to see the surgeon isn't until Thursday. I'm fully expecting to hear why didn't you come in sooner. The consult to see the surgeon will be exactly 9 weeks after the injury. Not a nurse or doctor, but I work in a diagnostic imaging department. Had a guy come into the ER because he was having trouble drinking and eating. Not because he couldn't keep food down or swallow, but because the dude had a f-king hole in the underside of his jaw that literally went straight up through his lower jaw into his mouth. He had an infection that he just let run wild that ate a huge disgusting hole on his lower mandible. The man literally looked like he had a vagina hole below his chin that traveled up under his tongue. Apparently he'd had an infection for a while and just ignored it. Doctor here. Might be a bit late and will probably be buried, but had a 65-year-old dude who was diagnosed with lymphoma 8 months before we saw him. He lived an hour out of the city and didn't want to drive in for treatment, so decided he wouldn't get treated at all and stayed on his little remote place in the country by himself. Essentially, because it didn't get treated, it spread along his skin and his neighbors called an ambulance when popping in on him. It had spread so far that it essentially went from his head to his knees. It had started to invade his eyes and mouth membranes. He couldn't drink and could barely see. His skin had started to slough off and he was so severely dehydrated because he was losing so much excess fluid from his open skin that we had to treat him like a severe burns patient and had plastics involvement. The consultant said if he had received treatment, there was a chance he could have recovered. Instead he died 3 weeks later. Had a kid that had a really bad sinus infection. Because of family stuff. The kid didn't want to complain about being sick, so just put up with it for a while. Long enough to form an empyema on their brain, which is basically an abscess. The kid had to have a drain placed above their eye to drain it, and we had to flush it periodically to get the pus out. Literally could have killed them. Or taken out an eye. I'm not a doctor, but a patient. Does my story count? So for a long time I've been feeling out of breath doing physical activities, and I thought it was because I was out of shape. Then at one point I started coughing a lot and I continued to ignore it until I started having chest pains. I went to the doctor and they did an x-ray and the entire left half of my lung was filled with fluid. There is a lining outside the lung called the pleural lining and the space in between is called pleural space. A condition called pleural effusion can occur where fluid fills up that space. Usually it happens due to injuries to the ribcage, pneumonia, TB, cancer, etc. But the doctor had not seen something as serious as mine and called his colleagues to come take a look and used me as an example of a severe pleural effusion. I was sent to emergency. A CT was taken and they discovered a bunch of tumors in my pleural lining. Then I had a biopsy and turned out I had stage 4 lung cancer. I was 33. In the initial surgery they drained out 2.5 liters of fluid from my left lung. Imagine having 2.5 L of fluid in your lung that's bigger than a big bottle of pop. And not going to the doctor. Not a DR or patient but friend of an idiot. My husband's childhood friend D just had a massive heart attack at the age of 26. Don't know all the details, but he apparently had a pulmonary embolism and his lung was so riddled with blood clots they were going to have to remove it. Apparently the DR asked him a question he didn't like, so he checked himself out of the hospital, filled his script for the pain meds and went home. My husband was so mad at him that he basically said, "Do whatever the FCK you want. You're an idiot," and got off the phone. We haven't heard anything good or bad at this point, so we hope he went to another hospital. Tough old lady from a rural area. She finally came in with an enormous fungating breast malignancy because she got sick of it bleeding in the shower. Sad trombone sound. Not a doctor or a nurse, rather a paramedic. We got called for an unconscious person. As my partner and I walk through the door, we're convinced there's a core in the other room because of the foul odor. Turns out our PT was not dead, only just extremely septic due to the fist-sized necrotic sore that formed on the top of their head. I mean, you could see the skull. Definitely should have called sooner. My mother was one of those holistic medicine types who preferred to treat her chronic illnesses with herbal supplements she could buy off of the internet. She had chronic constipation for months and a persistent sore on her abdomen that would not go away, no matter how much manuka honey she smeared on it. Long story short, my brother finally convinced her to go to the doctor for this sore that wouldn't heal, and they discovered that she had a tumor, the same one obstructing her bowel, that had eaten through her viscera and through her abdomen. She lived another 6 weeks. Stop diagnosing yourself on the internet. Friends. Edit. Unnecessary quotation marks and grammar. Patient had a small cut on their leg and had asked their family doctor for medical maggots to help heal the wound. Family physician obviously denied. Patient went home, opened up a can of cat food, and left it out until it was covered in maggots. You can see where this is going. Came in several months after beginning self-treatment with maggots with an insane infection. Never found out if they were able to cure it or amputate the leg. My husband almost died this summer, aged 36, from a dental abscess that was so badly infected. The thing was, everyone in the ED said, "Why didn't you take care of this sooner?" He had been to the doctor 6 times and the dentist 4 times over 6 months, who couldn't find the issue until he ended up in the ED. It was amazing. They all thought he was one of those guys who didn't go in. I was working at a CBP facility assisting migrants with emergency screening healthcare needs. I get this patient who can't be older than 50 that I'm talking to. He's part of a larger group and I'm checking them all out for scabies and etc. This guy nonchalantly goes, "Wanna see me feet?" in English. Naturally, my curiosity rises and I oblige. He wasn't in any visible distress and his gait wasn't altered in any way, so I'm not expecting any surprises. He's wearing these boots covering everything below his ankle. He sits down on the dirt and takes them off, revealing that his feet were gangrenous and eaten down to the bone. He wasn't in any pain because it ate all his f-king nerves. I was floored and was unsure why he, or anyone else in his group, didn't tell me immediately. Wild. Hope he's alright. I had one guy who had been just pouring essential oils over his bandages to mask the smell of his horrible diabetic foot disaster, specifically to keep his wife from noticing how bad it was. Unless she had no sense of smell. It did not work. Smelled like rotting death with a hint of lavender. Needless to say, I promptly removed the leg. He did well after that, and I had the diabetes educator go spend some time with him. I'm still just a nursing student, but my professor told us a story of when he was an ER nurse. An elderly 80-something-year-old woman came into the ER, and as he assessed her, he noticed her oral temperature was normal despite her neck being extremely hot to the touch. He decided to take a rectal temperature, which ended up being like 103 or something crazy. While he was down there, he noticed something peeking out of her vagina and proceeded to remove it. It was an old sock. She said her uterus had prolapsed months before and she was using the sock to keep it in. They began treating her for TSS immediately, but sadly she went septic and died later that day. Tongue in cheek, he told us she died of toxic sock syndrome. Us nurses have to use dark humor to cope. My brother was up a ladder next to a 2-story building which slid all the way down with him on top. He landed on his feet and the ladder hit the backs of his ankles. It was below freezing and early in the morning and his boss told him to sit in the van for the rest of the day. He's hobbling round for 2 weeks, occasionally asking me to gently rub his feet to get the circulation going. They were black and blue. I kept telling him he needs to get checked out but he kept insisting he was fine. Eventually he had breathing difficulties and he ended up in hospital with blood clots and they found he had severely broken feet. Ended up in a wheelchair for a while. Probably not learned his lesson. I cannot tell you how many patients come in with advanced cancer where they've been in denial about otherwise obvious symptoms. It's extraordinarily sad because denial is a powerful defense mechanism. And the later we catch a solid organ cancer the harder it is to cure it, if we can cure it at all. Most recent one that comes to mind is a lady with a breast mass that was taking up maybe 75% of her breast and ulcerating through her skin. She was trying to manage the pain with Tylenol and ibuprofen at home until the pain got too much.